Hello everyone, welcome back again to my YouTube channel. It's your Tooth Dr. Maureen Mara here, and on today's episode I want us to look at mouth breathing as the fifth oral habit, and of course how it affects our teeth and our mouth as well. Get into the video, guys, I want to believe that you've heard about this word mouth breathing, and it's important to note that a mouth breather is not just someone who breathes through their mouth. For instance, you are working out and maybe you are short of breath, you decide to compensate your breathing through your mouth. That is not a mouth breather. A mouth breather is basically a breathing disorder, and it affects individuals in many ways. And me being the tooth doctor, I'm going to look at the impact this habit poses to dental health. And that being the case, guys, the reason as to why I really need to address this habit of mouth breathing today, the logic behind it is very simple, and I'm going to share it with you. The more you breathe through your mouth, the more dry it becomes. The more your mouth is dry, the higher the chances of your mouth developing gum diseases or cavities are on the rise. Ideally, guys, our mouth need enough saliva to be healthy. So remember, and one of the functions of saliva is to cleanse the mouth, meaning if there is plenty of saliva flowing in the mouth, it reduces the chances of bacterial accumulation, which can lead to destruction of your teeth by having cavities or even having bad breath as well. So basically, when somebody is breathing through their mouth instead of their nose, this quickly dries up the saliva in the mouth, which we've seen plays a very important role and subjecting these individuals to a probability of, I will repeat again, of developing either gum diseases, dental cavities, or bad breath. Other than this, severe mouth breathing can also have other impacts on the teeth, whereby individuals can present with an open bite, where the teeth look like this, or an overbite, where the individual would present with teeth looking like these. And this is because of the tongue and the teeth not being in proper alignment. Of course, I said earlier, I'm going to focus on the impact of mouth breathing on our dental health. However, wanasemanga information is power. So what I'm going to do, I'm going to highlight some of the medical implication of somebody who is a mouth breather more oftenly. But then if you feel like some of those medical implications I'm going to highlight, someone suffering through that, and you will need more clarification of that, then I'll take the responsibility to get somebody who has specialized on that to come on board and enlighten us on that. And our number one medical implication of our mouth breathing is enlarged tongue. And this is a worry to us because someone who's a severe mouth breather and has ended up having an enlarged tongue, this can obstruct the airway, making it difficult for these individuals to be able to breathe well. We also have snoring, sinusitis, hay fevers, deviated septum, seasonal allergies, ADD, which is an abbreviation for attention deficit disorder. And lastly, on our medical implication, we have ADHD, which is an abbreviation for attention deficit hyperactivity disorder. That being the case, guys, remember we are talking about habits. And one thing about habits is that sometimes you may not know you have a certain habit until someone either points it out to you or the impacts of that habit have become visible. And on this particular habit of mouth breathing, if you're wondering whether you are a mouth breather or not, let's look at some of those signs that are going to answer you that. Number one, if you are constantly having dry lips and dry mouth, and this is simply because the inflow of air through your mouth dries the saliva, making your lips, your mouth and your tongue very uncomfortable due to the low moisture. Secondly, we have bad breath. technically known as halitosis. So if you are constantly battling bad breath and you've tried everything you can think of and the bad breath is maybe not away, then you can try and check out whether you are a mouth breather. And that has also reminded me, I did a video on bad breath. You can find the link in the description box if you want to learn more about bad breath. Thirdly, we have hoarseness or speech problems, waking up tired and irritable, snoring a lot, red or inflamed gum, especially on your anterior part. If you always have red gums, especially on these front part of your teeth frequently. We also have a frequent airway infection, have a sore throat, always cold-like symptoms more oftenly, and always feeling like your mouth is sticky, and lastly, poor sleep, no matter how many hours of sleep you get. If you looked at the aforementioned symptoms and you realize that maybe you're a mouth breather in one way or another, maybe you didn't know, let's look at why are you breathing through your mouth. And the number one common reason is most people breathe through their mouth because maybe their nasal breathing is limited in one way or another. Maybe they have sinus blockage, and what happens here is maybe they have some crazy sinus infection, which is blocking the nose from doing its job well. And this happens once in our lifetime. Unapata msee anashikwa na homa and they'll probably find themselves breathing through their mouth for a few days before they feel better. And this happened once, as I've said, it happens once in our lifetime. That does not qualify that you're a mouth breather. However, if you find yourself breathing through your mouth more oftenly and maybe your nasal area doesn't have any problems that could make you to breathe through your mouth, or even if you have like more frequent nasal problems and you end up breathing through your mouth more oftenly, then basically that means your problem is chronic and serious intervention needs to be checked out, and I'll be addressing that shortly. Secondly, another reason as to why someone can breathe through their mouth is especially if they have enlarged adenoids. Adenoids are this cluster of lymphoid tissues here, and for your information, these two things here, they help children to fight bacteria and viruses, only that sometimes they become infected and swollen, that blocking the airway, and you find somebody anaanza kupumua through the mouth. And the beauty about these things is that with the time they shrink as we all grow older. Mouth breathing can also be associated or attributed to oral and skeletal development, and this is majorly to those individuals whose lower jaw developed too small. So unapata the other tissues in the mouth are blocking the upper airway. So somebody is trying to compensate that by breathing through their mouth. Enlarged tonsils can also cause one to breathe through their mouth, and hapo unapata it's because if the tonsils are infected and end up being swollen, they block the airway partly, and these individuals usually struggle with breathing, so they end up compensating their kawaida breathing with breathing through their mouth. Deviated septum is our other reason as to why somebody can breathe through their mouth. A septum ni hii part hapa that divides our nostril, meaning if it is off center, that is, it is deviated, then it can cause blockage, a nasal blockage, prompting one to breathe through their mouth. Cleft palate is our sixth reason that can make one to breathe through their mouth, and usually for cleft lip and palate, these are birth defects, and that affects the structure of the mouth and frequently produce nasal deformities that tend to reduce the size of the nasal airway, making individuals to breathe through their mouth to some extent. We also have a tongue tie as a reason as to why somebody can be breathing through their mouth. And of course, I did a video extensively talking about tongue tie. If you want to learn more about that, I'm going to leave the link in the description box if you want to learn more. But just to mention, tongue tie is a condition in which the tongue is abnormally attached to the mouth, making the tongue movement more difficult, and these situations can also prompt one to breathe through their mouth. Lastly, we have sleep apnea. Sleep apnea is a condition in which someone's one's breathing is repeatedly interrupted during sleep, and this can simply contribute to mouth breathing. So guys, I've given you symptoms that you can check out to know whether you are a mouth breather or not, and at the same time I've also enlightened you on some of the reasons as to why one can become a mouth breather, or what can prompt one to become a chronic mouth breather, if I may say so. Now on to the segment that the tooth doctor loves most, whereby I give you tips on how you can manage such a habit. And for today, for mouth breathing, I'm going to give you some few tips on how you can manage this habit of mouth breathing. And for me, I'll prefer to approach the management of this habit of mouth breathing depending on the cause and when does someone do it. For instance, leave alone the one who have seasonal allergies. So if you have a cold and maybe your nasal breathing is being compromised, you need to breathe. That, luckily enough, that one should it is for a very short period of time, and that one should make you go back to normal breathing in the shortest period. However, if your mouth breathing is chronic, and maybe it could be you have enlarged tonsils, enlarged adenoids, you have issues with the deviated septum. These are things that if you get to visit a specialized ENT, they can be able to fix that, and you're going to your normal breathing through the nose. Also, if you have issues like a cleft palate, I believe luckily we have some institutions that do the repairs, especially to young children, sometimes free or at an affordable cost. So if you get a child and they do have this cleft lip and palate, it's good to seek an advice when the child is young. For this situation, I believe it is better to get to fix that, especially when the child is young. If you have a child or you get a child that is having cleft lip and palate, it should not worry you at all. These are some things that can be fixed and the child will be okay. So my first tip is to deal with the mouth breathing situation depending on the cause. If it is about tongue tie, this is it can be a very minor procedure if the child is young. However, if you are an adult, it's something that can be fixed. Of course, it will be some discomfort for a few days, but it can be sorted out and you go back to your normal breathing. Let's get to address the reason behind as to why you breathe through your mouth, so that it can be easy for the specialist, for the medical practitioner who is going to fix that for you. So secondly, once the root cause of mouth breathing has been sorted out, the other thing I'll advise is train yourself to breathe through the nose. I know this tip right here is easy said than done, but trust me, with regular practice and dedication, it's achievable. And it could be a habit you've carried for a very long time before the root cause got to be sorted out. But then once it is done, it is going back to you that you will really need a lot of effort to train yourself that the nose is the one that does the breathing. You can even try to hold your mouth so that you can be able to breathe through your nose. I believe that baby steps will, at the end of the day, help you to be able to go back to the actual mouth, to the actual breathing through your nose, or as you call it, the normal breathing. Thirdly, I could like to encourage any mouth breather, regardless of whatever is causing you to breathe through your mouth. And even as you plan to visit a professional for correction or for further management, I could really like to advise you for you to be able to protect your teeth, your gums, even your tongue as well. Please always make an effort of brushing your teeth 2 times daily, at least with fluoridated toothpaste, or you can rinse your mouth with fluoridated mouthwash. This is very important because it is going to help remineralize or rebuild the weak enamel that could be wearing away. And also another important tip, take as much water as you can. You're breathing through your mouth. Definitely the chances of your mouth being more drier are high. So if you breathe through, if you consume like a lot of water as much as you can, it is going to always keep your mouth moisturized, thus reducing the chances of you developing the gum diseases, cavities, or even having bad breath as well. And lastly, to parents who have children that breathe through their mouth more oftenly, I'll advise to get a dentist review or a myofunctional therapist review. And this one is important because now they are going to check the jaw development and its anatomy at large. And this one is very important because it is going to enable them to assess if the child has optimal airflow whenever the child is breathing. And I believe especially for children, the best and the optimal, the best and the most appropriate time to fix things is when these guys are young. So I'll highly recommend that if you're a parent and you have a child that breathes more oftenly through the mouth, it is important for you to get to visit the specialist so that you can get further advice. So guys, that is it from me today. I believe you've learned something. If you have to remember something from this video, then kindly remember that breathing through the mouth is not normal. It can end up like exposing you to getting lots of cavities, having recurrent gum problems, or even unending mouth breath, regardless of whatever you are doing. So it is important for us to always take care of our teeth. Thank you so much for staying tuned in today's video. Let us get to meet in my next video. Bye bye.